Okay, this individual reached out and asked if I'd looked into punctal plugs when talking about dry eyes and living with Sjogren's. I have, and I've shared this story before, so I'm going to share it again, just my experience of what I learned, which I think is really important for individuals with Sjogren's who might be considering punctal plugs. So before looking into things like punctal plugs, IPL, iLux, Bleffer, Blefx, those sorts of treatments that might be recommended from your optometrist, it's really important to understand where your dry eyes is coming from, because it could be because of one or two reasons. And so it's important to figure out what that is. So the first way that your eyes can become dry is by a breakdown of your meibomian glands. And so these are the glands that are inside your eyelids here. They look like little slits that go up and down. They're on the upper and the lower. And these are what secrete the oil layer, which is the outside layer of your tears. And that oil layer helps to hold the tears into your eye duct, and so they don't evaporate too quickly, causing you to be using a lot of blinking and aggravation and possible corneal scratches to your eyes. The second reason why a Sjogren's patient might have dry eyes is because of a breakdown of the lacrimal gland. And so this is a gland that's on the outer side of your eye. And this is what actually secretes the tears that go into your eye that are then coated in the meibomian gland oil. So, sorry, I'm dealing with really bad brain fog today. Bear with me. And so with respect to punctal plugs are a plug that they put inside, like right here inside of your eyes. They typically do the lower. They will sometimes do the upper ones for really severe dry eyes. And it basically works like a dam. So it goes in there, and then typically this area will drain out into the back of your throat and then whatever through your body. It stops your tears from draining so that they stay on your eyelid longer, and then you don't have to deal with as dry of eyes. Well, when I went in to see a dry eye specialist, he did a whole bunch of tests that told me where all of my dryness was coming from. And for me, my dryness was coming from both the breakdown of my meibomian glands and a reduced amount of tears being produced by my lacrimal gland. In fact, he did the Schirmer's test, which is where they put a piece of litmus paper in between your eyeball and your lid, and then you wait 5 minutes to see how many tears are developed during that time. That's how they tell how dry your eyes are. For me, my body did not produce any tears, like zero, nilch, none. And because of that, he said there's no real reason for putting punctal plugs in, because if you don't even have a river that's flowing, the dam's not going to stop anything. So for me, punctal plugs weren't a good solution to the problem. So I highly encourage you to have these conversations with your optometrist or ophthalmologist before you decide on spending the money on punctal plugs.